He's our first patient for the day, age 40. He has come to us with a diagnosis of hepatitis B positive, and kidney stone, renal stone. We saw him first in, it's been early, November last year, with primarily burning with the urine, and the left abdominal pain. পেটে আগে একটা ব্যথা হতো, সেটা কোথায় হতো? একটু উঠে দেখাও. There was a pain in that area which was worse from wearing tight clothes. The urinary burning, or there was incontinence of urine as well. He was unable to hold the urge for urine. That was worse in cloudy weather, cold and cloudy, overcast weather. That was worse. He also had burning in the abdomen, worse in the morning around 5 o'clock. That was the time he mentioned, which was worse from eggs as well. It was better by belching or eructation. He has a tendency for loose stools, which is worse in the morning. Hepatitis B positive, he says it could have been done from a blood transfusion. There was no sexual contact as such, as mentioned by him, so could have been from a blood transfusion. He has a tendency for a dry tickling cough from cold water intake, from a cold water intake. চুলকানি একটা হতো, কোথায় সেটা? He has itching in his chest and back, worse from undressing, worse at night. আগের রিপোর্টটা আছে? কোথায় সেটা এনেছেন আজকে? যেটাতে পাথর ধরা পড়েছিল, সেটা কোথায়? নিয়ে আসুন একবার গিয়ে। He's gaining weight. আগের রিপোর্টটা আছে, দৌড়ে গিয়ে নিয়ে আসুন। Premature ejaculations. Sometimes when he's anxious, his mouth becomes dry. He loves his sweets and loves his meat, but meat can flare up the gastric issues, meat can flare up the itching. Smokes quite a lot, around 10 per day. He can become angry with throwing of things when he's upset. We saw him November and we started with Natrum Sulph. Natrum Sulph is a remedy which has wonderful affinity for the liver. So, many times many metromedicas don't mention it, but if you see in Borike it mentions liver is a very important area of affection for Natrum Sulph. Here, lot of burning in the abdomen, burning with the urine, right? That's a sulfur feature. Burning in the abdomen, burning with the urine. Affinity for the liver. That's one of the important areas of Natrum Sulph, right? Very importantly, a tendency for loose stools, right? Natrum Sulph is a psychotic remedy, right? But there is an exception to that psychosis. If you consider the modality of psychosis, it's a daytime aggravation, sunrise to sunset. But with Natrum Sulph, although it is a psychotic remedy, You can have a 5 a.m. aggravation in Natrum Sulph as well, which is important. It is specially marked for asthma, but even with other complaints, Natrum Sulph can have early morning aggravation, which honestly is a sodic aggravation, right? Early morning is a sodic aggravation. But although Natrum Sulph is a psychotic remedy, so it's a peculiarity miasmatically for Natrum Sulph, that although it's a psychotic remedy, it still has a 4 to 5 am aggravation. If you look in the respiratory section in Boric and Natrum Sulph, you'll find it's mentioned a 4 or 5 am aggravation for the asthma especially. You're with me? Yeah. So he mentioned something about 5 am with but one of the complaint, right? Yeah. So yeah, so that's the miasmatic peculiarity of Natrum Sulph, being a psychotic remedy. Although also Natrum Sulph being a sulfur component, desire for sweet, you have that in Natrum Sulph, right? Some Natrum symptoms or some sulfur symptoms, right? As well as Natrum Sulph is also a remedy which has an undressing aggravation. Also a remedy which has an undressing aggravation, right? So the cloudy weather aggravation is also there. I forgot to mention that. Something, I think the urinary symptoms are worse in cold and cloudy weather. So the damp component of Natrum Sulph, right? With the burning of sulfur, the loose stool tendency. Again, it's a psychotic remedy. Any psychotic remedy will have a tendency for loose stools. Natrum Sulph is no exception to that. With the desire for sweet of sulfur, 5 am aggravation is a peculiarity of Natrum Sulph being a psychotic remedy, and the cloudy weather aggravation. Undressing aggravation is also a part of Natrum Sulph's totality. But most importantly, it has a very, very good affinity for liver complaints. If you see in Boric abdomen section, liver sore to touch with sharp stitching pains, cannot bear tight clothing around the waist. I think also he mentioned something like that, tight wearing, worse from wearing tight clothes. So Natrum Sulph can also have that with the abdomen. So you can add that as well, aggravation wearing tight clothes, especially in the abdomen, right? So that's important for your Natrum Sulphs.
What do you write for sulfur burning, abdomen and what?
Urine.
It's issues with tissue salt and they emphasize liver.
Liver, yeah. Liver is a very important part of Natrum Sulph's pathology. Initial report shows a kidney stone. It was 7.6 millimeter. I hadn't advised to do an ultrasound because I generally ask them to do it after 6 to 8 months. I've just seen him since November. It's 3 months. But wonderfully, the gallbladder the kidney stone is not there at all now. That's the follow-up report from December. Natrum Sulph 200C was prescribed just once in November. We have boosted in December. January we have boosted. You see, it's in bold. There's no evidence of any kidney stone because they tried to search for it, but they couldn't get any of it. এটা দুবার করিয়েছেন কেন? এর আগের এই রিপোর্টটা আছে? He hasn't done the reports for the hepatitis. You see, if it's a correct remedy, it can work even prior to your expectations, you know. I expect generally 6 to 8 months to get it better, but it's completely gone in no time. ঠিক আছে, একটা ফোলা ছিল বলেছিলে, লাইপোমা ছিল, পেচ্ছাপে জ্বালা টালাগুলো কিরম আছে?
জ্বালা আপনার একটু
Burning in the urine is around 70% better. His belching is better as well. He had a lipoma on his left hip, which he didn't mention on the first visit. He says that's better now. ঠিক আছে, করে দিচ্ছি। Lipoma on his left hip, which is better now. And also, if you think of the pathology, renal stone, psychotic growth, that is taken care of by Natrum Sulph. Although if you see in the recent pathology, it mentions in his last ultrasound that there is thickening of the gallbladder and grade 1 fatty liver. But I hope Natrum Sulph will take care of that as well, because it has a wonderful action on the liver as well. Right. 200C just once in November. You're boosting today as he is much, much better, the medication. Okay. Sorry? Prostate is a little enlarged. Sorry? Yeah. It's there. But again, those are psychotic pathologies, you understand? And that Natrum Sulph, as being a psychotic remedy, will take care of it.